Hi, my name is Nikki Klein, and I am a speech language pathologist at New York Eye and Ear. Today, I'm going to be discussing the impact of hearing loss on early speech and language development. When your child has a hearing loss, you may decide to use spoken language, sign language, or a combination. Whichever approach you use, the key is for the child to have complete access to the languages used around him or her. In order for a child to develop comprehension and use of clear spoken language, they need to be able to hear all of the sounds and words around them because we say what we hear. So when a child has a hearing loss, they're at an increased risk of developing speech and language difficulties. Children with hearing loss may not learn words as fast as those with normal hearing. They may have trouble understanding and using longer sentences. They may have trouble hearing word endings like plural s, irregular past tense ed, like hat versus hats, or jump versus jumped. They also may not hear sounds well, and as a result, may have trouble speaking clearly. There is no substitution for hearing in the acquisition of spoken speech and language skills. 90% of what children learn is through overheard speech. So either hearing caregivers talking at home or hearing people talking on TV, and not just what they are directly taught. So when a child has a hearing loss that is not managed appropriately, they miss out on all of these opportunities to hear speech clearly or at all to develop their own communication skills. Early intervention is extremely important because the brain is programmed to learn language during the first 6 years of life, with the first 3.5 being the most critical. When children with hearing loss receive appropriate amplification and speech and language therapy early, they can learn to speak as well as children without hearing loss. At the Ear Institute, there is a team of speech-language pathologists who are specialized in working with children who have hearing loss learning spoken language. When your child has a hearing loss, it is imperative to work with a speech-language pathologist who is knowledgeable and experienced working with children who have hearing loss to ensure that a child is achieving expected developmental milestones regarding speech and language development and their auditory skills. Keep in mind that most children are listening for 12 to 15 months before they even say their first words, and they are developing the fundamental skills for acquiring more complex speech and language development. When a child has a hearing loss, they have missed out on early hearing and learning experiences until they are fit appropriately with amplification. So it will take time and intervention for children's brains to form the connections needed to be able to understand and say sounds and words themselves. As Steve discussed, when a child has a hearing loss, they automatically qualify for early intervention in New York. At New York Eye and Ear, the first few sessions with a speech-language pathologist will focus on working with families to increase their understanding of the impact of their child's hearing loss on spoken language development, creating a treatment plan for supporting the child to achieve communication milestones, and teaching caregivers strategies to create a language-rich home. Through demonstration, guidance, and coaching, caregivers learn how to support their child's speech and language development across environments throughout the week. As discussed, children are active listeners the first 12 to 15 months of their lives and are learning so many different speech and language skills before they even say their first words. Babies are expert communicators. When your baby cries, coos, or tugs at you and you respond, your baby is learning how to communicate with you. During the first 12 months of life, a child who has normal hearing is learning to respond to sounds in their environment, starting to associate these sounds with their sources, learning to understand frequently heard words, and making a variety of speech sounds. So when a child receives amplification, they will need to progress through these skills similarly before understanding and saying their first words. In order to support your child at home, either while you're waiting to see an audiologist or receive amplification, or when your child first receives amplification, here are some strategies that you can use at home. First, create a quiet environment by limiting background noise. This means turning off the TV and music and closing windows when communicating with your child so that he or she can hear you clearly. Speak closely to your child. Position yourself similarly to the man in this photo at your child's eye and ear level so that you are easier to see and hear. Point out sounds frequently heard at home and name what they are. So for example, if you're outside and you hear a fire truck go by, you can point to your ears. Oh, I hear the fire truck. Point to the fire truck. Make the sound that a fire truck makes. And this is going to really help build your child's awareness of sound and learn that sound has importance. Talk to your baby throughout the day to build his or her vocabulary skills. So talk about what the baby is doing, what they're seeing, what the child might be feeling during everyday routines like changing, feeding, sleeping, playing. Again, this is going to help build your child's awareness that speech has purpose, but it also provides multiple repetitions of the names of important people, toys, and actions throughout the week. Use parentease. Parentease, or sometimes referred to as motherese, is that exaggerated sing-song and repetitive way that adults naturally communicate with young children. Research shows that babies are actually drawn to this type of speech, and babies love to hear the voices of familiar people. Play with sounds and noisemakers. So similar to pointing out sounds that naturally occur in your baby's environment, engage in sound play, whether it be playing with a rattle or playing with musical instruments or just banging on pots and pans. Play with sounds in a playful way and point out these sounds to your baby and discuss the sounds that each of the objects are making. Engage in serve and return interactions. Imagine that your interactions with your child are a game of tennis. Serve is any time your baby attempts to communicate with you, and return is your response to your child's interactions. Serve and return interactions begin as soon as your baby is born. When your baby cries and you respond, this is a serve and return interaction. Back and forth interactions build a strong foundation for your child's language and social emotional development. When your baby makes a sound, make that sound back at your baby. These interactions help your child to learn that his or her thoughts and feelings are important to you. Sing with your child. Babies do not care if you have a good voice or not. Singing and making music are among the most enjoyable learning activities for children. Read to your child. It's never too early to start reading to your baby. Even if your child does not understand what you are saying yet, you are building his or her early enjoyment of books and building those early literacy skills. And finally, make it fun. Play with your baby, engage in early social games like peekaboo. Play provides so many opportunities for cognitive, physical, social, emotional, and language development. All of the services discussed today take place at New York Eye and Ear Infirmary of Mount Sinai's Ear Institute, located at 380 2nd Avenue on the 9th floor. New York Eye and Ear is one of the oldest specialized hospitals in New York and the largest New York hospital center-based early intervention program for children with hearing loss. It offers comprehensive care under one roof. In addition to the services discussed prior, the Ear Institute has a highly specialized and skilled team of otolaryngologists, otologist neurologists, cochlear implant services, physical therapy, voice and swallowing therapy, social work services, education counseling services, and other professionals who all work collaboratively. Today's discussion has focused on young children impacted by hearing loss, but hearing loss at any age can have serious consequences, including cognitive and learning dysfunction, depression, falls, and difficulties with social interaction. The professionals at the Ear Institute are equipped to thoroughly provide services and care across the lifespan. If you have any questions about the information presented today, please don't hesitate to reach out with questions to myself, Derek, or Steve. Thank you for joining us.